Greetings, History of Medicine students. This is Professor Bowen here with some comments on Quiz 2. If you will recall, our second quiz of the semester dealt with the history of medicine in ancient China. For the first question, I asked about the divergence of Chinese and Greek therapeutics in ancient times. And most of you did quite well on this question, successfully explaining that one of the key divergences in these two medical systems had to do with bloodletting, or phlebotomy, as it is sometimes called, which became increasingly popular in ancient Greece due to concerns about plethora, this medical condition related to excess blood in the body, whereas in China, the practice of bloodletting increasingly died out with the passage of time because Chinese views of the body emphasized the dangers of emptiness. It was with the second quiz question that we had a little bit more difficulty, so I wanted to focus on that and talk at some length about what exactly I was looking for here. If you'll remember, this was the question where I asked you to analyze a passage from the ancient Chinese medical text, the Yellow Emperor's Classic of Medicine, and particularly I wanted you to use that to illustrate the point that Nathan Sivan makes in his article about how one theme of Han-era medical literature was this idea that rulers need to listen to their advisors, and specifically medical advisors. Many of us drew attention to select passages from the Yellow Emperor's Classic of Medicine, in particular to the excerpt from the chapter on the sacred teaching that deals with the 12 viscera. This is the chapter that compares various bodily organs to political officials like the king, the general, the advisor, the judge, the court jester, and so on and so on. This was an excellent portion of the text to select, and it does relate to the quote from Nathan Sivan's article that I cited in the question. However, at times we struggled to explain how this Han-era medical text puts forward the argument that, as Sivan puts it, quote, the monarch should take qualified advisors seriously. In order to effectively illustrate this point, we needed to provide some evidence of doctors' attempts to elevate their status, to improve their positions within the Chinese political hierarchy. So how did the author of this book use the text to try to get rulers to listen to physicians, to take them on as medical advisors whose counsel they respected and deliberately sought out? As some of us noted, this medical book does reflect doctors' desires to not be controlled by rulers and to exert some influence on them. But how exactly does the text do this? How does it make the case that the king's powers should be limited and that medical advisors have something to teach them about how to govern? In answering this question, then, we had to talk not about the responsibilities of the advisor, but about how and why emperors needed to change their behavior and to accept physicianly counsel. One of the ways that the Yellow Emperor's Classic did this was by discussing what would happen if doctors' sage advice was ignored. Another example of this can be seen in the excerpt from the 3rd century text Springs and Autumns of Mr. Liu, which Sivan cites in his article and which reads as follows, and I'm going to quote here from the text. Quote, states too have their stases. When the ruler's virtue does not flow freely, i.e., he does not appoint good officials to keep him and his subjects in touch, and the wishes of his people do not reach him, 100 pathologies will arise in concert, and a myriad catastrophes swarm in. The cruelty of those above and those below toward each other arises from this. The reason that the sage kings valued heroic retainers and faithful ministers is that they dared to speak directly, breaking through such stases. Close quotes. There are lots of good examples of this from the Yellow Emperor's classic as well. To give just one of these, at the end of the chapter called Treatment of the Mind and the Body, the author talks about how to accurately diagnose a patient's illness. Understanding a patient's color and complexion are regarded as especially important, as without this knowledge, malpractice and injury to the patient might ensue. Then, right after this, the author asks, quote, "You see, if this same thing were applied to running a country, what would happen to the country?" The suggestion here is that rulers need to consult with doctors in order to effectively manage their kingdoms and the populations contained therein. Because the diagnostic techniques that doctors use when assessing the problems of individual patients' bodies are things that can also be applied, metaphorically at least, at the level of the body politic as well. It's clear here that the consequences of not heeding doctors' counsel will be things like instability, rebellion, war, and all other kinds of disasters. So here in this one sentence, we have an illustration of Sivan's point. All right, so hopefully these extended comments prove helpful. If not, or if you have any other questions about quiz number 2, please do get in touch ASAP. And if not, I really look forward to seeing you in our week 5 discussions. So see you later. Bye-bye for now. Ta-ta.